Okay, this session is on residential supportive living within the community. And Jessica Roote is with Ravenswood Supportive Living, and they have a living program that she's going to share with us the ins and outs of and the benefits about supportive living, which many people can greatly benefit from. She'll explain to us how we are able to receive supportive living and a supportive living arrangement. And Jessica is in charge of sales and marketing over at Ravenswood. So I'm going to turn this over to Jessica now. Thank you.
Good morning, everybody. Thank you for having me. So yeah, I just want to talk a little bit about what supportive living is so that seniors know what their options are. There's kind of some myths between supportive living and assisted living. So maybe clear some of those myths up. So supportive living is unique to Chicago or to Illinois. It started here. There's some other models in some other states, but they're not really like what Chicago offers. So we're really lucky to be here in Illinois and have this benefit. Supportive living is very similar to assisted living, but the big difference is the way that we pay for it. So assisted living is pretty independent living, and there's help and support there when and if you need it, and each little thing that you need help with is an extra fee. Where supportive living is a pretty unique model. It's for low-income seniors 65 and older. There are some that are for 24 to 64 for those that might have disabilities, but mostly it's for 65 and older and low-income seniors. So basically payment for everything that we're about to talk about is your Social Security and or pension, along with Medicaid. You would have to have Medicaid. And that pays for everything. And then you get $90 from that to spend each month. That's kind of a hard thing for seniors to kind of adjust to, but you have to think in terms that we're going to talk about. We'll break it all down, but everything's covered. So you're not paying an extra fee for extra services that you might need from the staff. So when you kind of go through now what you're paying and what you actually have to spend truly on yourself at the end of the month is probably close to or less than $90 really, once you pay all your bills. So in supportive living, we have nurses there Monday through Friday. If you need the nurse, you need her. If you don't, you don't. Nursing assistants are there 24 hours. So if you ever need anything inside your apartment, if it's an emergency, there's a pull cord in the apartment and you would pull the pull cord. If it's just, something that you need a little assistance with, you would have the front desk number. You'd call the front desk and they would get a nursing assistant for you. Typically in all supportive livings that I know of, it is your very own apartment. Okay. Which deciphers from nursing home. Nursing home, you're sharing a room with somebody and they're doing everything for you. So you're not keeping that independence and growing stronger. You kind of actually, grow a little weaker. So even if what we're going to go through today is not for you now, it's just something to start thinking about. It's good to go into a living situation such as this when you are independent and active and fairly healthy. And as your health declines, as we know it all will as we age, that support is there when you need it. You don't have to make a move, less stress on you, less stress on your family. You're already in the place, and then you just start utilizing the services that you need as you need them. We have your very own Dr. Pham that comes in twice a month right now to see residents. So you could keep, your own physician that you have right now, and go out to your doctor's appointments, or you can have the luxury of just staying home on days that maybe you're not feeling that well, and going out to the doctor could be, you know, a bit of a problem. So all supportive livings have a physician that comes into the building to see residents so that they have that option. Physician, pharmacy on site. So your prescriptions are delivered. Every supportive living works with a different pharmacy, but there's always the option to get your prescriptions to come to the building so that you don't have to go out and get them. And the nurse kind of manages them in, you know, little pill boxes for you so that it's very easy to take. And the level of assistance with that medication varies on what your need is. So if you're fine taking your medicines on your own, you keep them in your apartment and take them just as you do now. You know, if you decide that maybe you want some medication reminders, then the nurse would bring the medication up to your room when it's time to take that medicine. Some supportive livings have medication passed by the nurse, which means that you would go down to the nurse's station. They always keep the medicine down there. You just come down to the nurse's station and take it when it's time to take it. So we do help with activities of daily living. So if maybe showering could be a challenge sometimes, there's support for shower time to someone to be on standby, you know, when you're showering. So, you know, maybe getting the bottom half of your clothing on is a little bit of a challenge. And so there'll be a little bit of help there for that. And if you don't need any of that assistance, you know, you don't have to have help with any of it, but it's always there if you need it. We also help with laundry. You can do your own laundry, or someone at the building can do your laundry. And typically in supportive living, it's about once a week. See, many of the services that you need, x-rays, labs, physical therapy, home health care, if you ever need to use home health care for a time being, they're all welcome to come to the building and see you. Some supportive livings have particular home health or PTOT groups that they work with, and some let you use whatever is good with your insurance, and you're free to choose whoever you're used in the past, or maybe that your doctor recommends. A lot of times they bring in specialists such as podiatrists and dental and vision that would come right to the building also. And again, you have that option to see the doctors that come to the building, or you can still go out and see your own doctors. They do well-being checks once a day. So if you don't use any of the services, at the very minimum, someone's going to knock on your door, ask how your day is going, is everything all right, and be on their way. And then you live the rest of the time, you know, completely independent. In supportive living, it's different than a nursing home. You don't have to get a day pass to go out. You're free to come and go, you know, as you would living in any independent senior building. The same goes with having guests, unless things like COVID arise and we have to follow CDC and those kind of restrictions are put on. But other than that, you can have any of your own guests come and go. In supportive living, all 3 meals are included in you know, the payment package. So you would have 3 chef prepared meals. There's, you know, the main meal, and then if there's something about something in that meal that you don't really care for, there's always another option. Most supportive livings do not cater to special diets though, so you would still kind of have to watch your own diabetic diet or kidney diet, but we don't make that, you know, difficult. We're not serving you completely unhealthy food. There's always snacks and coffee available. Like I said, everything's covered, so your gas, electric, water, sewer, basic cable, Wi-Fi. In all supportive livings, that's all included. So the only thing really that you would be responsible for is like your cell phone, any hygiene products. You would have to furnish your apartment. But most supportive livings, if you're having trouble, you know, with some furniture, we offer assistance. Let's see. Oh, so you would have your hygiene products, like your cell phone bill. If you wanted a landline, those would be the things that you would pay for. Other than that, everything's covered. We talked about the laundry services. Housekeeping comes once a week. So you know, they'll mop the floors and clean the bathroom and wipe your hard surfaces off, as far as keeping it straight and, you know, dusting your little knickknacks and stuff. That's still kind of up to you, but at least the heavy work is done. You know, you can sit back and not have to worry about straining yourself with the heavy work. There's always activities.
Do you mind if I call you back? Because I'm in a Zoom class.
There's always
No, that's
activities
okay. You
scheduled,
don't have to apologize.
and supportive livings have an activities director, and they plan activities in the building and take trips out of the building, to the store, you know, really whatever the residents' needs are. You know, if you have a good activities director, they're going to meet with you and find out what your likes and dislikes are, and take your suggestions on trips that you want to take, you know, going to museums or, you know, whatever the case is. Along with those daily activities, you know, we have a lot of exercise programs and fitness programs that are offered. Some supportive livings most of them have gyms or some kind of physical therapy room that those exercise classes can take place in. Helps keep your mind and your body, you know, sharp. The whole idea of supportive living is to keep you independent and self-sufficient for as long, you know, as long as possible. You could avoid going to a nursing home at all by, you know, being in supportive living, and you could, that would keep you independent, you know, for a very long time, and then, you know, fall back on that support on the days that you need it, and other days you're independent. We talked about shopping trips, and we do bring entertainment into the building. We have, you know, it's different for each supportive living, like I said, because it's based off of the residents that live in that building. So, you know, things like singing groups or, you know, music, any kind of little entertainment that we can get to come into the building to entertain the seniors, is always a big thing. We do have, most of them have little chapels with services, some non-denominational, but depending again on the population of the residents, they'll bring in whatever denomination is represented by the services there. We talked about the emergency call lights. So they're in your apartment, in the bathroom, in the hallways, and in all the common areas in case you ever, you know, needed anything. And, you know, supportive livings have lots of different community rooms, libraries, computer rooms, the gym, like I said. Most of them have on-site salons. So, you know, hair, nails for men, shaving and haircuts, those kind of things. Oh gosh, what was I thinking on the lines of that? Any questions so far? I don't know how to see my people out there. I'll have to wait for Judy to come back. So some of the things you start looking for when it's time to make that change is, you know, changes in your mobility. If you know that you're not getting around as well as you used to, or maybe falling a little bit, then it's nice to be in a place like this, because there's always staff around to maybe remind you to use whatever assisted device, you know, that you're walking with or whatever. The 3 meals, you know, so maybe if cooking is becoming a challenge, That may be another reason, to start thinking about something like supportive living. There are those 3 meals and snacks throughout the day. In your apartment, you do have a refrigerator, freezer, and a microwave, so you can still do some things on your own. You can bring, and all supportive livings are this way. You can bring in, different things, a coffee pot, toaster, air fryer, Instapot, slow cooker, so that you can still do some cooking. You may have a guest over and you want to have a little something for them when they come, and you want to have, still have the ability to do those kind of things. I know our building does, and a few of the other ones that I've been in usually have a community room with an oven in it. So we do activities, if the residents, it's something that they're interested in around maybe cooking different things and trying different things that maybe your neighbors make, that you're not used to, having, they share those with you. And then too, if you wanted to put a dish together, take it down, put it in the oven, just have to usually let the front desk know so that they know that it's being used and that it can be shut off properly, and you bake whatever you have. And those community rooms are nice too, if you don't always want to entertain in your apartment, then you have that space to visit with your family and friends. Most places have libraries and computer rooms, with computer classes to help you keep up on, bus passes or IDs or things that need to be renewed at times. So all these things in assisted living, each thing you're paying something different for. Now, if you have money and you want to pay in a supportive living setting, you can. It's still going to be a one fee, and all those things will still be included in that fee. But typically, you have Medicaid, or we help you apply for Medicaid, and they pick up the rest of the cost. I mean, that's really all of the things that supportive living has to offer. Again, just the comparison with the nursing home, getting into a program like supportive living, this is your choice. You get to look at the different ones in the area and pick where you stay and where you live, and, grow old gracefully and stay independent as long as you can. If something happens and it's, situation where you have to go into a nursing home, you don't always get to pick where you get to go. Your insurance kind of dictates where you would go. Like I said, you're then sharing a room with somebody. And the nursing home really they're doing everything for you. And so that takes your independence away. It kind of, your health doesn't thrive as well when somebody's doing everything for you. So it's just nice to know that this option's out here. Like I said, it may not be for you. It may not be for you right now. You may know somebody that could benefit from a supportive living situation. Did anyone have any questions? Judy, I'm not sure how to get back to see if anyone online has questions, but yes, sir.
Must you be on Medicaid? I mean, in other words, what is the cost, and where are these facilities located?
Yeah, so there's 2 here in the city. There's Ravenswood, and then there's Greenview, which is like in the Lakeview neighborhood. And then most of the other ones are south and west of the city, or in the city, or in the suburbs. There are some in the northern suburbs too. So in the city, it's just kind of really starting to grow. I mean, the program's not that old. It's only about 10 years old, which is not old at all, So you don't have to be on Medicaid, but it really is designed for low-income seniors. So if you, sometimes living in the community, you're not eligible for Medicaid, but when you make this decision to move into supportive living, then those eligibility guidelines kind of change, and then you are eligible. And if you were to pay out of pocket, right now, our apartments and everything that we discussed, it's $4,500. Okay,
But if you are on Medicaid, it is picked up, right?
so if you're on Medicaid, it's your social security and or pension and Medicaid that pay for that. And then you get $90 each month from your social security to spend on yourself.
So you will take the social security and the pension to pay or partially pay for the 4,500 you alluded to.
Right.
And then you will get $90 for personal expenses.
Right.
Is that the picture?
Yes. Yeah.
But
I mean, we don't essentially, most do not take it every,
I don't mean,
right, right. But some people get that in their mind and they feel like they're losing control of their money. So you essentially would go to the business office and pay rent like you would in any, apartment living situation.
so you would add the social security and whatever pension you have. And then those funds will go to pay for the facility, except for the $90 that
Exactly.
you get for your personal
Right.
expenses.
Right.
Is that correct?
Yes.
Now, does Medicare they subsidize this concept in any way?
No, it's Medicaid and then your social security and or pension. I mean, you should have Medicare anyway, just for your own health and medical needs, but it doesn't factor into your living
So a
situation.
one-bedroom apartment costs about 4,500.
Yes.
You're suggesting, okay.
Yeah.
And again, I just want
All right, Rose, and I will talk to you later.
so you do not, in order to qualify, i.e. in order to become part of this community.
Sure.
You do not have to be on Medicaid. You can be on Medicare because you're over 65.
Right.
And you can become a part of the community if in fact you are willing to pay
Right.
the fee.
Right, right.
2,500 or whatever the amount is.
Right.
Did I understand it correctly?
You do, yes, absolutely. And then the good thing about that too is when you're paying $4,500 a month, for me, that's not going to get me very far. I mean, it would get me maybe 2 or 3 years, right? Because you're not working, so now you're living off of your pension, your social security, and maybe whatever little savings you have. So when that runs out, you don't have to move. So now you apply for the Medicaid and that kicks in and covers that other half. So that's the nice thing about it too, because you're already in a nice place that you like, that money's running
But
low.
there is continuity.
Right, absolutely.
But if in fact that scenario is the case, you would still get, let's say, Social Security,
Yes.
presumably. So you would have to surrender or pay out of your Social Security whatever amount is offered
Yeah.
minus the $90.
Right.
Okay.
Yeah.
Did anyone, I'm sorry, were you through, George?
No, I'm done. Thank
Okay,
you. Thank
you're
you.
welcome. Are there any questions from anyone on Zoom? I re-muted some people because there's a lot of noise in the background. So I see some of you have unmuted yourselves. If you have any questions, please come forward.
How do we find supportive living places? Is there a listing of them or a department?
Well, it's just kind of Googling supportive living. And they'll come up. Like I said, there's just the 2 right in this area right now, the Ravenswood and Greenview, that are actually in this part of the city. Again, they're mostly, south and west. and then in the suburbs. But you could just Google supportive living and the list should come up. And some of the, I think even too, if you go on just the Chicago website and go to like the senior, do you know what
It's the Department of Aging.
yeah, the Department of Aging should have a section on there,
And
and they, if they don't have an exact listing on there, there will be someone that can help you. There are paid services like a Place for Mom and different things like that too that can help you, but there's the free ways to do it, because you know you don't want to spend your money on all that.
Yeah, and you don't want to be, I've always I do not encourage you to do a Place for Mom,
Me
because a
either.
Place for Mom, once they get your contact information, you're on their list forever and ever and ever, and they, you know, it's just a continuous contact, and they become bothersome. But supportive living housing options were designed by the state of Illinois, the Medicaid program. So you can go to the Department of Human Services website, and they'll give you the listing of the agents or the locations throughout Illinois. So they have them all the way downstate to like Rock Island, in different locations. So if you wanted to move to another location, you could feasibly do that. One thing that I've been introduced to independent living, which most of you all are doing now because you're on your own, but there are facilities that are independent senior residential buildings where you pay your rent. Some of them offer a meal plan that comes included within your package deal, but you get your breakfast and your dinner. You don't get lunch. You get some of the activities, and they take you out and about. They do a lot for you while you're there for what you're paying. And those places you can either have a studio, a 1-bedroom, or a 2-bedroom for the most part. Then you have assisted living. Once you get to the assisted living part, as Jessica was saying, you start paying for every little piece. You start paying not only for your food, you pay for your nursing staff, you pay for your homemaker staff, you just continually pay. You pay for a nurse to give you your medications. And so you can estimate sometimes about $7,000 to live in an assisted living. What's attractive to me for supportive living is because I see my base of seniors that I work with, that I've seen for the past 10 years, and I think that you deserve something better than a nursing home. And what I'm seeing happen is that hospitals and doctors, once you're discharged, will sort of push you towards a skilled nursing facility. Some people don't need a skilled nursing facility. I saw one of our members within the past month, and I said, "Oh, where are you staying now? You know, are you still in the same location?" She says, "No, I'm at a skilled nursing facility." And I'm looking at her and I'm like, "You're able-bodied. Why are you in a skilled nursing facility? You need to be living on your own." Once you get to a skilled nursing facility, after your 20 days, your money's gone. You're on Medicaid.
And that's why we're here today to tell you about this, because even some of those professionals at the hospital don't really know that this model exists. So I'm still out there trying to educate them too, but it's most important to educate y'all, because this is your life and you need to know those options. And when they say, "Oh, we're going to send you to this nursing home," then you can say, "Hey, can I try this?"
Yeah.
And then it's up to that supportive living facility to look at your records, to meet with you and make sure that we can support the needs that you have.
Yeah.
So we didn't talk about that, but there is that component where we would need some notes from your doctor. We would meet with you individually and make sure that we can support, that you can voice your needs and that we can support those needs.
But
Yes, sir.
Would this be on a temporary basis?
What's that?
It would not be, right?
The living,
Let's say if you were to be sick and end up in the hospital.
yeah.
And you were to have to go to a facility, could one go to your type of facility, supported living, on a temporary basis?
So that's what like the nursing homes are designed for. So you would say that you fell and you were in the hospital. You might, after you leave the hospital, even if you did some rehab at the hospital, you may do a week or two or maybe a month in the nursing home to do that rehab. Then you would come home to live in a supportive living situation. That's where you would live. If you still needed some therapy, we would work with you to help find physical therapy or occupational therapy to come in and work with you. But this would be your home. It's not usually seen as a temporary situation. It's a permanent situation to keep you out of those temporary situations.
And there seems to be an umbrella, i.e. all-inclusive, which I think is very reassuring.
Mhm.
Yeah. And it's very unique again to Illinois. So we're really lucky to be here and be able to take advantage of that. So
It's
yeah.
very unique because, you know, and I'm happy that someone from the state level decided, they're looking at different plans and the way people are aging and the options that we have as we age. And at one point, and I think the shift started a few years back when the state said, oh, we're paying these skilled nursing facilities all this money, people, and they become just a housing unit. And sometimes you have 4 people in 1 bedroom. And that's not a comfortable setting, you know, for some individuals. You want to be by yourself. You want to be able to entertain by yourself. You don't want to have a room with other people, with others. And then you want to have better service. And the skilled nursing facilities are understaffed. They're overloaded. And the type of patients that they get versus having someone that's quite healthy, that's able to manage on their own, it doesn't balance.
Yeah, those people that are in the nursing home and able to manage on their own, then because they're in the nursing home, they're not able to manage things on their own. For liability reasons, the nursing home has to help them with just about everything. So you're not using those independent skills and thriving, you know, you're just kind of, okay, you know, do it for me. So that's where the supportive living model comes in and keeps you independent longer.
And I've seen a couple of our
Jessica,
members.
I have a question about the insurance. You said something about depending on your insurance. So under supportive living, there are doctors and medical things provided, or what is the depending on your
So I
insurance?
think when I was saying depending on your insurance, I was speaking about if you ever had to use a skilled nursing facility, a nursing
Mhm.
home. That's where you don't have the choice to pick which one you go to. Sometimes you have to go based on who takes your insurance.
Yeah.
where-
But how can you afford insurance if all your money is going to pay for your
Well, that's the-
housing?
So in the supportive living, you've got your Medicare, Medicaid, right? And that covers everything for you. And then if you did have to go to those skilled nursing for some rehab, you know, each supportive living partners with the skilled nursing in their area that takes Medicaid. So that you go to a facility that takes your Medicaid and is good and reputable, and we know they're going to take good care of you and bring you back home.
I think,
Okay,
I,
if you are
I'm-
not on Medicaid
Uh-huh.
and you come in and you have some kind of Medicare insurance, then that is what you live on until you run out of money and then you go on Medicaid. Is that what you were saying?
no, your insurance has nothing to do with it. Your health insurance, your Medicare health insurance has nothing to do with the amount the facility charges. So,
Well, in a way, she's right, because if she doesn't have Medicaid, she's paying into insurance.
but if she has, if she has a insurance plan, like a Blue Cross Blue
Uh-huh,
Shield
uh-huh.
plan, and
No,
that's.
I have a PPO at the moment. I have an
Right, yeah.
HMO.
So
I-
you would be accepted in our
Right.
facility, but I think what you're asking is, yes, you're gonna
Who-
pay.
Who covers the question
Yes,
is, do
you
your
would-
doctors treat me? Do I have some benefits that way, or?
Yes, so the doctors that come in would accept those insurances. You're still welcome to keep your physicians in the community. We would help you find transportation. We don't have our own transportation, or some supportive livings do, but most of them don't, but they work with you then to help you find whatever transportation is out there to get you to those outside appointments too. So you can still keep your other positions under those.
So
insurance.
you wouldn't be driving anymore, and once you're in these.
You
places.
can, if you have a car and you can drive, we encourage you to keep doing that as long as you can. Absolutely.
Okay,
And then also, once you get to that Medicaid level, you're on Medicare, you consider dual eligible. So you won't lose your Medicare status. You'll just switch to a different type of healthcare plan.
okay.
But I think what what I was hearing Jessica say is that when you're in a hospital setting and you're being discharged, you may have a Humana plan, a Humana PPO plan, or a Humana HMO plan. You want to go to, I'm just going to name Alden. Alden may not take that HMO plan, so you can't go there. Self-help may not take the HMO plan, so you can't go there. So you have to find a nursing home facility that accepts that Humana HMO plan. Whereas if you were to opt for a supportive living, you don't have to worry about what healthcare plan you have, HMO, PPO. You will be eligible for a supportive living arrangement.
Yeah, I mean, it does sound like the benefits are to be in the supportive living, to be on Medicaid is the benefit, but then.
Yeah, it's a Medicaid design program.
But
and
it will
everybody's
cover
not gonna-
everything, it'll cover everything that you need, or there'll be extras because you have very little income then, you have that $90.
It covers everything medically. So like your
Okay.
prescriptions,
Okay.
the doctor visits. Is there something specific you're thinking of covering that maybe I could answer?
No, I
Or
don't have anything in
Okay.
mind, I don't have many.
yeah, I
right
mean,
now.
it does cover, between the Medicare and the Medicaid, it covers all of that. And
Okay.
when we do transition our residents to the Medicaid, we encourage them to drop those other plans because there's no need to pay into it. Whatever Medicare doesn't get, Medicaid's got, so it doesn't make sense to spend the extra money on those plans. Unless, there's a doctor that you're attached to that maybe doesn't,
Except Medicaid.
yeah, doesn't do the Medicaid, but a lot of them are now, so that should not be an option. I
see.
mean, an obstacle, sorry.
Yeah, I mean, at the moment I don't pay, but I do pay for doctor visits, and you're saying doctor visits would be covered and.
Right.
And so I always, because I work as a SHIP, I see you over there, George. I work as a SHIP counselor. And so
Right.
I know that once you become dual eligible, you're still eligible for your Medicare.
Yeah,
So I always encourage people, stay with Medicare, opt, and then you have your 80% is going to be paid by Medicare. Medicaid is going to pick up the extra 20%. You have a better option of seeing doctors and even getting into facilities if you have a health insurance status or plan along those lines. So if you keep your Medicare and then you have your Medicaid, you have your 80% Medicare, your 20% Medicaid, and you're covered. I can't tell you what to do, but if you opt for a different type of plan, then you'll have to fall into a network type of setting.
Right.
And then most doctors, they'll see Medicare and Medicaid, they know they're going to get 80%. They may have to wait 5 years for that 20%, but they know they're going to get that 80%. So they're going to take Medicare and Medicaid.
Gotcha. Okay, thank you.
You're welcome. George, you had a question?
Yeah, I said, you could in theory, not qualify for Medicaid, but not have enough money, to actually reach the 4,500 that is required, the amount that you alluded to. So
that
you may not qualify for
Yeah, I got you.
Medicaid and not have enough money out of your Social Security and pension to reach the $4,500 level. In
Got
which
you.
case, this program would not be available to you. Is that correct?
You are correct in theory. It doesn't happen. I've not run into that happening, but it could very well happen.
Because the
Of
program
course.
is designed for
Yeah.
Medicaid.
Right. And so, the other piece to that is, and they just increased this, So if your income is more than 43,800 a year, that's too much to live in supportive living.
How much?
43,800.
Okay.
Used to be 39,180, but they just increased it to 43,800. Okay, so that's like if your social security and pension add up to more than that annually, you would have too much to live in a supportive
So
living.
you would not be able.
You would not be able
Okay,
to,
so
but
you would not
honestly, I've not had anybody that I've worked with reach that. Sadly, you know, our retirement benefits are not as great as I feel they should be. So that's when this model is super beneficial.
And I see so many people, I'm not gonna say so many people, I see a good number of our senior members that could benefit from a supportive living lifestyle. They would have housekeeping done, they would have their meals prepared, they would have assistance with grooming, they would have activities, they would have a social life. Because some of, you know, and as we age, the thing is, we get so determined and set in our ways that we're not gonna do anything else. No, I'm not doing that, I'm not doing it. And it just, I'm like, oh my God, you could just, if you were in a different setting,
Yes.
I would feel so
And
much
I've
better.
seen that happen. I've seen people come in that, you know, the families help them move in thinking, we don't know what else to do. They won't come out and even sometimes join family activities. And then they get in, we have this in our particular building. You know, one of our residents had a really hard time during COVID, and once COVID was kind of let up, she was still, you know, I'm not going anywhere. She runs every program at our building right now. You know, it's how much it's changed her. She's involved in everything, and therefore she's getting around better. She's eating better. She's her mental health. That was all her family complained about, was how her mental health was just deteriorating. And now I'm telling you, she's running all the activities. She's getting the rest of the seniors involved. And so, I mean, that's just one example of how being around your peers just make your life, you know, more complete and more enjoyable.
And I had someone, I'm gonna share this example. I have this person I'm thinking of right now, that I've encouraged for supportive living or to change her living style, because she lives by herself. She's up in age. She lives in one of these buildings where she has a 1-bedroom apartment. She has to wait until October for her landlord to turn on the heat. If he turns on the heat, then she has other issues within the apartment building. She has people running, you know, children running in and out all day long. She doesn't want to move. So there's a language barrier also. And I had a rep in that was of her language. And I said, can you talk to her for me? And before I knew it, the rep was actually trying to talk her into moving into the nursing home. And I was like, no.
Yeah.
She does not belong in a nursing home.
See,
She belongs in the place where she can still remain independent, have some things in place for her, but not a nursing home. No.
yeah, we gotta just keep educating seniors and the community, because we need to let them know that this option is out there. Yeah.
I think the overwhelming majority of people do not want to end up in a nursing home.
No.
And I think
But-
that is,
Right. And that's what people think, though. They think they live independently, and then the next step is a nursing home or assisted living that they can't afford. So we really, you know, spread the word to your friends. And I'm going to keep doing things like this to keep educating seniors and the community that we work with that helps and supports seniors, so that we know how to direct you and let you know what your options are.
And there's some retirement places, but a lot of these places are very, very expensive.
Yes, ma'am.
I wonder, how do you go about finding a facility where they support living? But I don't want to go to nursing home.
Yeah.
I want to look around before I get in trouble, then you don't have time. to look.
Absolutely. That's the point of today, is to start looking and thinking and making these. So if you Google supportive living, you know, make sure those words are in there. Like Judy was saying with Medicare, you know, and the Department of Aging.
I see. You know, 10 years ago, I went to that place around Belmont and Sheldon.
I think
Mhm.
that's Greenview, yeah.
Yeah, it was about $2,000 a month. During the time my mom was sick, I was thinking we probably, but she doesn't have $2,000 per month to
Yeah.
move in. So
Um,
now I start thinking, how do you go about handling a place like where you can afford it?
So that may have changed a little bit, that specific facility that you're talking about, because all supportive livings are set up the same way. So there might, if maybe she had a little bit of money and they were telling you the private pay cost was 2,000, but you know, like I was saying, ours is 4,500.
4,500.
Right, but the idea is to use your social security, get on the Medicaid so that you're not paying that.
Oh, so
Because you're right, you don't have that. I would only last maybe a year or two paying.
4,500 per month for the rent?
Okay, so when you, in order to qualify for Medicaid, you can only have between $5,000 and $2,000 in your savings. Okay, some people don't have that. So you would never, if you don't have that, you would never have to pay that 4,500. It's just going to be the Social Security and or pension, and Medicaid picks up the rest. So you don't have to worry about a cost of a room. The only time anybody would pay that 4,500 is if they had a little bit of money in their savings. But supportive living and all of them are designed for low income seniors. So you should never have to pay like a market value like that. It would just be the Social Security and or pension, and Medicaid picks up the rest.
And here are some of the locations I pulled up.
Yeah.
And most of us have heard of Beth Ann Place. We've heard of Covenant Home of Chicago, which is right up the street here on Foster. We've heard of Eden.
Now this is the one that's 22 to 64.
Mhm. Cute little story.
Yeah.
This, there was a young lady who lived in the Eden, I think it was 920 West Gordon, that she lived in that facility up north here. And then the facilities would have like gatherings, and she met her husband who lived at the 71st
Nice.
South Dorchester location, and they eventually moved to the Dorchester location. But here are some of the
Yeah,
places.
Grand Regency, Greenview Place,
Mhm.
Symphony. Yeah.
What's the first one? Or just give me one.
You have Greenview Place here.
Greenfield,
Mhm.
Greenfield is in.
I think
worked
that's
at
the
so
one that
many
you.
of these.
Mhm. You did work with these?
Yeah, Prairie Green. I worked at both of those.
Okay.
But those are all south and west, you know. But you might be ready for that change, you know. It may not matter, you know. Maybe you have family around those areas. So we just got this by pulling supportive living,
Mhm.
and then it said in Illinois. We clicked on that, and it brought up this whole list.
And here you have Ravenswood Senior Living, which is a newer facility. It's really nice. It's a really nice
Yeah, and they're just
facility.
in alphabetical order. That's all they're in. You would have to kind of research yourself. It gives the address. You'd have to just kind of see what part of town it's in. Oh my God, I worked
So
in so
you
many.
just type in support living. and
Yeah,
then
can you go back
Mhm.
one?
Yep. So I typed
Oh,
in,
maybe one more. Oh, I'll do it again.
yeah, I typed in supportive living in the search bar.
And then living facilities in Chicago pops up, and you just click on that.
Mhm. And you'll see they have them in Lake County. They have them in DuPage. So you're not just, you don't have to just stay here. So if you have family members that live out near DuPage area or Lake County, you can try one of those locations. And then you'll see how these pop up. These are the assisted living, but the Eden Supportive Living falls up under that. So I just went to the Cook County Supportive Living Program.
And that's on the illinois.gov website. So that's what I was referencing earlier. So it took us right to there. you know, and even these are in the suburbs too, a lot of these, Des
Mhm.
Plaines, Elk Grove. So it brought up the city and surrounding areas. Do you have a phone?
I'm sorry,
Do you have a cell phone?
yeah, I do.
Do you want to take a picture of the screen?
Oh, I have one of those real old ones.
Okay.
I can run you off a copy before you leave. I'll go
Okay,
back upstairs and
Yeah,
run you off a copy.
yeah.
But
And then
then-
that way, you know, because they're in alphabetical order, so they're not in any geographical
Oh,
order. So
yeah.
you would want the whole list so you could kind of see,
Yeah, I could kind of search.
yeah, where you're going to.
Okay, are there any more questions or comments?
You know, when I called the ship counselor, I could never get through.
Would you call the Department of Aging? I'm gonna stop recording this. If we don't have any more questions pertaining to the lecture. Jessica, thank you very much.
Yeah,
Thank you
for
all,
having us.
certainly.
Thank you so much. I've been trying to